Hello dear students, welcome back again to Chinmoy's Biology channel. So today we are here with the last part of health and hygiene. So let's get started without delay. We have already completed all the previous parts. If you have not yet gone through those parts, I am putting the link in the description box below and I am putting them in the I box above also. So go through it so that it will be easier for you to learn this episode. So let's get started. So what are the learning objectives of today's lesson? So we today will be studying about the cleanliness and hygiene. So what are the unhealthy habits and lifestyle? We will be studying about first aid, that is first aid for burns, first aid for fractures, first aid for insect bites, first aid for snake bites and all. So all the types of first aid we will be going to study today. So dear students, please do subscribe to my channel before starting the lesson. If you are subscribing to the channel, you will get the updates whenever I'm posting. So please do share it with your friends so that everyone should know that the lesson in a systematic manner as I am teaching. So please subscribe, stay tuned, stay updated with all my lessons. So let's get started. Now, first, to maintain a proper health, we should maintain cleanliness and hygiene. So, what we should do? So, many diseases they can be avoided by maintaining cleanliness and hygiene within and around ourselves, and by taking simple precautions. What are those? So, those precautions are: we should not eat stale food or uncovered food. We should always eat fresh food that is not contaminated and they are not transmitting disease then. So we should always drink boiled or filtered water. We should store the drinking water in a clean container with a cover. So this we all know. These are our basic things which every day we are doing. Then also we are just revising them so that it should get inside our head whenever we are writing in the exams. We are clear about all these facts. We should eat a balanced diet and do regular physical exercise. We should take care of personal hygiene. We should take bath regularly and wash hands frequently, especially before and after meals. We should stay away from infected persons and keep our surroundings clean. We should follow regular immunization schedules. So what is regular immunization schedules? So for kids and all, we are having all vaccines and all. So that regular immunization schedules from the age of 3 to 6 months till 10 years, that immunization schedule should be followed to prevent certain life-threatening diseases. Right? So then we should move on to the unhealthy habits and lifestyles which people are leading and which can also lead to disease state. Now here we are taking unhealthy habits and lifestyle. Now several diseases are acquired by either following unhealthy lifestyle or by getting hooked by several bad habits such as smoking, drinking, chewing tobacco, drinking alcohol, consuming narcotics and so on. So we should stress first on the tobacco consumption. So what happens when a person is chewing tobacco? So that can lead to oral cancer. So chewing tobacco can lead to oral cancer, right? So it can lead to oral cancer. Now if they are smoking tobacco, they are smoking cigarettes, so that can cause cough or respiratory problems as well as lung cancer. So they can cause lung cancer, they can cause respiratory problems and all. So there are several diseases of the respiratory tract such as cough, constant coughing. These are all they are all related to cigarette smoking. They can also cause irritation of nose and we can say throat. So they can also cause irritation of nose and throat. So nose and throat irritation also happens. Nose and throat irritation is also happening. Now next we are taking alcohol consumption. So what will happen if they are consuming alcohol? So alcoholic drinks, they are actually they are shutting down the brain, they are slowing all the brain activities and they are weakening the control system when taken in large quantities. Now it is also damaging the brain as well as the liver. So it is damaging the brain and the liver because alcohol consumption is slowing all the activities of the brain. It is taking the nerve under control so that the person who is consuming alcohol is unable to perform all the activities properly. So all the parts of brain are affected by alcohol consumption, and if they are doing continuous consumption of alcohol, then the liver is also affected. Now next comes drug addiction. So drug addiction, what is happening here? When a person is addicted to drug, narcotics such as cocaine, heroin, marijuana and opium, these are all drugs, and they are having severe harmful effects that can lead to addiction. So once a person is starting consuming drugs, what is happening? So he or she has become addicted to this drug. So physical and psychological dependence is produced on that drug itself. So during physical dependence, the body requires continuous supply of the drug, and that is called the drug addiction. So the body is continuously dependent on the drug, and that is called drug addiction. Now people, they take drugs to have fun, to relieve boredom, and to satisfy the curiosity to escape from the reality due to peer pressure. But it is not the fact, right? If you are you want to enjoy something, you are addicted to drug, it is affecting your body very badly, and you are getting addicted to that. And at times overdose of these drugs, they depress the central nervous system. So they are directly acting upon the central nervous system, and with the respiratory failure leading to death. So this central nervous system being affected by drug, continuous overdose of drug, leads to the respiratory failure, which leads to death. Right, this is one of the harsh or severe effects of drug addiction. Now next comes the consumption of fast food. So nowadays people, they are mostly dependent on fast food. They don't eat their homemade food. So what is happening? These fast foods are quickly available: burgers, pizzas, samosas, and so on, so which are rich in fats and have high caloric value. So consumption of such food items, they frequently, it leads to not only obesity, but it also leads to several stomach and liver diseases. So consumption of these fast food not only leads to obesity, but several liver and stomach diseases, and they cause increase in the blood cholesterol also. Okay, they are also causing severe effect on blood cholesterol. So cholesterol levels of the blood are increasing as they are having high content of fat, as they are having cheese and all. So that is not good for health. So these are all unhealthy habits and lifestyle which people are adapting in their lifestyles, and this is leading to several diseases. Now let us say any other unhealthy habits or unhealthy lifestyles, what are they doing? So physical labor has reduced, so the muscles and the body organs are barely exercised. So most people, they do not exercise, they do not tone their body muscles, and it can lead to diseases like high blood pressure, obesity, heart problems, etc. So there are about we can say that 31 lakh or more than that diabetics in India. So it is an approximate value. So which is we can say that most of them are having type 2 diabetes, and we can say that we can increase the exercising habits to increase our body function. All the organs metabolic activity should be proper if we are exercising daily, if we are walking, exercising, and doing physical laborious work, so that we can combat many diseases. And we should always lead a healthy lifestyle and stay away from all these things. So let us move on to the first aid part now. It is very important. So we are going to discuss about first aid, that is first aid given in cuts and bruises, in case of burns, and in case of bites and stings. So first we should know what is first aid, right? So let us start. So what is first aid? So the immediate help which is given to a person before a formal treatment in case of an accident or sudden illness is called a first aid. So we should have a first aid kit at home. So it should have basic medicines, it should have ice pack. See, first aid ice pack, it should be always in fridge, so we all know that. But in first aid, this ice application, there should be gloves, there should be bandages, there should be handy plaster and all, there should be an antiseptic cream, lotion, there should be few medicines, painkillers and immediate working medicines. There should be a pair of scissors, there should be we can say that in case of burns, those medicines we can say that which are applied on burns, on cuts, on bruises, those should be there. So what precaution we can take place in case of first aid given to cuts and bruises, given to burns, given to bites and stings, given to people having poisonous bites, snake bites? We will learn all those in this lesson. Now, in case of cuts and bruises, what is a cut? Now, cut is a break in the skin, while bruise is an injury to the tissues under the skin. So, cut is always a superficial one, and bruise is an injury to the tissues under the skin. So, what we can say that the cut is a break in the skin. So, it is a break in the skin. And what is bruises? These bruises are, we can say that these bruises are an injury under the tissue. These are injury under the tissue. So these are injury under the tissues, and these are bruises, only break in the skin. So what will happen if this bruises and cuts are happening? The first application of ice pack should be given to reduce this black or blue spots or marks. We can say that first ice pack application is there. So if there is a superficial cut, we should wash the area properly and we should dry it properly. We should use an antiseptic lotion and then cover, and then with a clean bandage we should tightly cover the place so that it should be kept away from any dust and dirt, and it helps to keep the cut clean and it heals very quickly. So this is in case of superficial cut. Now in case of deep cut, we should put a clean pad or a cloth on the cut, then apply pressure on top of it, and then stop the bleeding first. Then if the blood soaks through the pad, what will happen? Then place another pad on top of it, and then after that the bleeding stops, we should apply the antiseptic lotion and put a tight bandage around the wound. So this process, this should be done, the cleansing of this wound and application of antiseptic lotion and tightly binding this lotion should be the tightly banding this cut area should be done every day, every alternate day or every day, so that the wound should not get infected with bacteria. So it should be cleaned properly and proper dressing should be done. That is in case of a deep cut. In superficial cut, you wash it, you apply an antiseptic lotion, and in 1 or 2 days it will heal. But in case of deep cut, it takes a little bit time. So like this we can do the first aid. Now what happens in case of burns? Now, first aid for burns, which depends on the extent of the burn. So, there are 3 degrees of burn. Now, first we can say the first degree burn, second degree burn and third degree burn. So, what is first degree burn? It results in only the reddening of the skin. You can see the skin has become only red, and we can just run cold water over the burnt area for 10 to 15 minutes and our burning, that reddishness will go away gradually. Now, second degree burn is a serious burn which form blisters. You can see here blisters have come out. So, first is only reddening of the burnt area. Second is formation of the blisters. So second degree burn. So what we will do, the blisters are filled with watery liquid. So we can immerse the burnt area in cold water, but we should not break the blisters. And if by chance the blisters are breaking open and the water has come out from the blisters, we should just wash the area properly, cover it with a clean bandage, and we should so that the burnt area should not get dirty and get rubbed against each other. Now in case of third degree burn, what is happening? Generally the clothes get stick or the burnt material gets stuck to the this burnt area. So we should not pull them off. We should cover the area properly with a clean cloth and apply ice pack on that area and immediately seek medical attention. So that is, immediately we should go to a doctor, we should move to a doctor, and immediate medical attention is required. So that is in case of third degree burn. So first and second degree we can just treat them at home only, but in case of third degree burn we should take the person to the doctor immediately. Now, first aid given to poisonous snake bites. So, poisonous snake bites, what first aid we can give in? Suppose a snake has bitten. So, what we can do? Immediately we can keep the patient calm, and because the patient will be panicking because he has got a snake bite, and if your heart pumps faster, what will happen? Your venom or after the snake bite, the venom will be pumped faster throughout your body. So the patient should be calm. We should never try to assess whether the bite is from a poisonous snake or it is a non-poisonous snake. We should immediately take the effect. So we should clean the wound and we should use an antiseptic lotion, and we should never use potassium permanganate. We should use a antiseptic lotion, just a Dettol, Savlon and all, any antiseptic lotion, clean the place. And to limit the spread of the venom, we should bandage the bitten area firmly. So you can see here the bitten area is being firmly or tightly bandaged we should not give any alcoholic drink to the victim, and we should not give rather any food and water to the victim to keep the rate of metabolism slow. As soon as he eats or drinks anything, the rate of metabolism becomes faster, the heartbeat increases, and the venom gets pumped. Now we should try to draw out the venom within 5 minutes of the snake bite. So how we can draw out the venom? We can cut the area. You can use the standard suction method also, and devices are there also now available. We can put it in that spot, and by suction we can get the venom out as much as possible. Then we can take to the doctor or the hospital. So this is the immediate first aid you can give in case of snake bites, right? So let us move on to the next one now. So what first aid we can give for the stings of insects? So first, if certain insects such as honeybee or wasp, when they sting, it is severely painful and it causes a lot of discomfort. So what we can do in such case, we can keep the person calm and remove the sting with the help of tweezers. So if it is stinging here, we can remove the scales to this sting with the help of tweezers. With the help of an adult, we can scrap the area well with a blunt knife, and it should not cut, but we can just rub the area with a blunt knife so that the sting comes out. We can wash the area with soap and cold water and apply oil, Vaseline, and cover the area with a sterile gauze. Now as this area will be paining a lot, what else we can do? Because it becomes hot after the sting of bee or a wasp, we can apply ice pack, or we can apply ice on the swollen area so that it will cause less burn or less pain. So these are the immediate effects. Now if you want, if it is severe, if it is not reducing in half an hour or 1 hour, you can take the patient to doctor. So doctor will give prescribed medicine, or he can give a painkiller to reduce that sting pain, and gradually he will tell that to wait for 6 to 8 hours and it will gradually go. So that first aid you can give at home only, just rubbing the area with a blunt knife, or taking out the sting, washing it up, and then applying Vaseline or applying ice on the area, right? So next we will move on to the if an object falls in the eye, what will happen? Now if there is an object in eye, so what we should do first, whenever there is an object in eye, the foremost thing is we should not rub the eye. We should lift the upper eyelid, and we should lower eyelid, and we should try to enable our to pick up the particle, or to just move the eyebrow here and there so that the particle comes out normally. Now we should try to blink our eyes few times so that the particle should move to the corner and we can take it out. We should flush water continuously, clean water to our eye, so that that small particle comes out of the eye and we are having a clean eye. Now next, if the particle remains, we should just keep our eyes closed, and if it is possible, then go to an eye doctor and get that ophthalmologist, right? So ophthalmologist, and get that particle removed with the help of the ophthalmologist. So at home we are trying to wash our face with water, take out that that particle by moving our eyes here and there, by blinking the eye so that it moves out of the eye. But if it is not happening at home, then we should move to the ophthalmologist, an eye doctor, and we should get it removed. Now we will move on to the in cases of bleeding. Now bleeding can be life threatening, right? Now there are types of bleeding. The first one is if there is a bleeding in arterial or venous bleeding, that will be too much. But the capillary bleeding, if it is here in the capillary, it will be small, so we can wash it off and we can just apply antiseptic and all. But if this arterial and venous bleeding is there, so we should raise the part so that the blood should not flow downwards. We should apply pressure on the bleeding part with a clean cotton pad or a clean cloth for at least 10 to 15 minutes, so that the bleeding should stop and the blood should clot. So we should do not wash the wound area except in case of a dog bite. And when the bleeding stops, we should apply a mild antiseptic lotion and then cover the area firmly with a clean bandage. So we should cover the area with a clean bandage. We should hold that area tightly so that the bleeding should at least stop. Now what will happen in case of nose bleeding? So we should, in case of nose bleeding, we should sit upright. We should not lean forward. We should use a tissue paper or soft cotton towel. You can see here they are using a tissue paper or soft cloth now to soak the oozing blood from the nose. We can place an ice cube also, and we can do cold compress on the nose. So we should not consume any drug, in this case nasal bleeding, without any prescription. If sitting upright, holding ice cube on the nose, soaking the blood with a tissue paper is not working properly, then immediately we should take the patient to the doctor, and we should not consume any medicine without prescription. So it's very dangerous. We should not take any medicine without prescription. Now suppose what will happen, what type of first aid we can give in case of fractures. So what are fractures? It is a crack in a bone which requires immediate attention. So in case of fractures, if there is any bleeding, we should try to stop the bleeding by applying pressure. Just in the previous topic we have taught you that how we can stop the bleeding. We just hold the place with a clean cloth and then try to apply bandage. We should make the person lie down comfortably, immobilize the injured area, and we should apply ice pack, as it will be paining, ice pack to reduce the swelling and relieve the pain. And we should not apply ice directly. Instead, we should wrap the ice in a piece of cloth and then place it on the affected area. We should try to calm down the person also, because as the person gets panicked, the pain will also increase like that. So now this is in case of fractures. Now let us move on to unconsciousness. Now, what will happen if a person becomes suddenly unconscious? So, now if a person is unconscious, we should take the person, make the person lie down comfortably, remove her socks and loosen her clothes. So we are unaware of the fact that why that he or she has become unconscious. So we should not let the crowd form around the person. Let the fresh air come in, and if needed, we should use a fan, or we should take the person in a well ventilated place. We should check the pulse. We should sprinkle some water on the face. If the person is then also after 5 to 10 minutes not gaining consciousness, then we should immediately take the person to doctor. So these are the basic first aids which can be given to the person at home. Otherwise it should be taken to a doctor. Now next one comes. Now, what if a person has swallowed poison? So, what first aid we can give in? So, we should check the symptoms for poisoning, such as drowsiness, unconsciousness, and all. If they are having difficulty in breathing, if they are vomiting, if they are having nausea, and we should check around the mouths and lips if they are becoming blue or not. So, we should remove the remaining poison from the person's mouth. We should get the person fresh air, and we should try to induce vomiting, so that whatever poison has gone to the person's stomach should come out. And immediately we should call the doctor, call the ambulance, and call for medical help. So that is how we can deal with all this. Now let us move on to the next one, where we'll just do a few keynotes. Now, what is anti-venom? This is important. What is anti-venom? So, an anti-venom serum is made by milking the venom from one or more species of poisonous snakes. So, from the poisonous snakes only, by milking the venom, we have produced the anti-venom, and then the hyperimmunizing we are using this on an animal. Generally, horse is being used for hyperimmunization with injections of the increased dosage of venom. So then the animal's blood, that is the horse's blood, they start producing antibodies against this venom which was weakened and injected to the horse's body, which increase as the dosage increases. So the amount of antibody in the blood increases when the amount of venom injection is anti-venom, that is injection is increased. So the blood from this hyper-immunized animal is drawn, and its serum and plasma without fibrinogen and the blood cells. What is serum? That is the plasma without fibrinogen and the blood cells, right? So this blood from the hyper-immunized animal is drawn, and its serum, which is containing the antibodies against the venom, is extracted, and it is refined, and then it is produced. It is used to produce the anti-venom serum. So this is a bit difficult procedure. So it is first the anti-venom is injected to the animal's blood, then after antibodies are produced from this hyper-immunized animal, it is drawn out from the blood. That is the blood containing the serum, it is drawn out. That is the blood containing the antibodies of the venom, that is extracted, and it is refined to produce the anti-venom serum. So what is serum here? Again, serum is the plasma without fibrinogen and the blood cells. Is it clear? So serum is the plasma without fibrinogen and the blood cells. So it's the plasma without fibrinogen and the blood cells. So this is all in today's episode, and I have completed your health and hygiene lesson. Please go through all the individual episodes which I have taught, and it is very clear whatever part is there in your curriculum. I have covered each and every part. And don't forget to subscribe to my channel. Whatever updates I'll be posting, I'll be doing revisions on each and every lesson. So stay tuned, stay updated with all my episodes, and I'll be putting the link above also and in the description box as well. Go through it and complete your lesson on health and hygiene. Thank you.